And you're filming me now. You can go up close and far away.
So we're
starting.
starting already. Okay.
Get your finger out the way of the lens in the front. You get your face.
I have. I got
That's
you.
okay.
So right.
Okay.
What we doing? What are we doing this for today?
I wanted to inspire people and let people know that I've got cancer and I've known about it since February. And I think it's a nice way of letting people know that obviously the initial finding out was terrifying, but now that I've gone through the flow, I'm feeling really good about it. My life has never been so good. It's a very sort of crazy thing to say, but that's it. And you want to know how I found out?
Well, can I just say something?
Yes.
Actually, by saying like you haven't got a cancer, you look amazing.
Exactly.
For somebody that has a cancer.
I know, it's very strange.
I mean, okay, yes, you were on holiday,
yeah.
Which we're going to talk about later, but you do look very good.
I know,
you look healthy.
Quite crazy, really.
You
when you
look
think.
well. No, that's quite good.
I know, but it still makes me feel a bit. Oh, what's going to happen when I do start going downhill? At the moment, I'm feeling really good.
Well, like you said, you want
again,
to
what
keep
I'll do is I'll let you
positive.
know. This is how it all began, basically.
Yeah.
I had a cough in January, and it was one of those coughs that lasted a month. And I thought there was an advert on the TV saying, if you've had a cough longer than a month, then you've got cancer. You could have cancer. So I went to the doctors and said I've had this cough.
Yes.
And she just said, I think we better send you down for an X-ray.
Yes.
Went the next day for an X-ray, and they found a small shadow on the right-hand side, of my lung. So at that moment in time as well, which was quite odd, I was getting what are you doing with your phone?
No, I'm going to the questions. Carry on.
So basically, at that moment in time, I was having some double vision. I had some trouble with my eyes. So I went in for an MRI scan on my brain, and I just...
you first went to the GP, basically, didn't you?
No, but then again, I rang up the doctors again.
Ah, right, okay.
Listen to me, what I'm saying is this. Basically, so what happened was, I went for my MRI, and they found 3 lesions in my brain. 1, 2, 3 in my brain.
Right. So,
the neurologist said to me there and then, I think that you've got a little shade in your lung, which we don't know about at the moment, and we found this, so we're going to have to send you in for a biopsy. So I went for a biopsy on my lung, and this was in end of January, and where they put a needle in your back, which isn't very nice, it's about that long.
Was the end of this January, end of this year?
Yeah, January just gone.
January just gone.
And they snipped off 7 bits of the infected area, took them away, and sillily, this was the bit that really hurt me, was East Surrey Hospital informed the brain hospital. What have you just done?
The only option I found is East Surrey Hospital on Canada Avenue in Riddell.
That's your...
Sorry, my phone's went off. I put it on silent.
That's okay.
So basically, they informed the Royal Marsden in London that I had cancer.
Right, but
they
not
hadn't
you.
told me. So the following day, I got back to work and had a phone call from the Royal Marsden, and it said, "Could you come and see us tomorrow, please, Mr. Simpkins?" I said, "Well, what's that all about?" It says it's regarding your lung cancer.
Wow.
I said, "Well, I didn't even realise I had lung cancer because the East Surrey Hospital hadn't told me." I went into total shock, obviously. Then I had to walk up to my boss. So I couldn't process this at all. So basically, I went home and was totally terrified. Obviously, I told Joey. He was very upset. And then what I did was I went back the next day to the hospital.
No, what did you think of that? I mean,
how do you tell somebody over the freaking phone they got cancer? I thought I was supposed to sit in front of a board of people and they all sit down, they're all happy and go, "Well, I'm really sorry, because..." So basically, a week later, I went back to the doctors and I had a room with a Macmillan nurse who did my nutting.
Yes.
Because she was going, poor you. And this big black doctor went, da-da-da-da-da. And we had a bit of a chat. He said, "Yeah, you got stage 4 lung cancer. It's gone into the nodes." I said, "Great." And then I said, "So what's the consensus on it?" He said, "It doesn't look good." And that was the last thing he said. So me and Joey walked out of the hospital. I was in tears. She was in tears. I couldn't find my car because I'd totally gone blank.
So they basically didn't say
anything else. It was very bad.
Else.
So basically what I did was I made another appointment for a couple of days later and went and spoke to somebody that made me feel better, basically. So that, don't worry, there are other treatments we can do on this. So basically after that, it was a case of bit by bit, really. They said that it was in my lung. I had 3 little things in my brain. I went off and had brain surgery, which is called a cyberknife. That was very good. That was 70 minutes where they did this laser surgery on my brain. So that's more or less gone now, supposedly.
I see you actually better when you're laying down.
Oh yeah,
sorry.
So basically, yeah. So they went and did the laser surgery on my brain, which was fantastic. Royal Marsden's a lovely hospital.
Yeah.
And hopefully that should be okay now. And my lungs. So after the biopsy, they found out they were going to put me on this thing called immunotherapy, which they're going to try. Which is
So can you tell me a bit about that?
Oh, immunotherapy is basically what it is. It really ups your immune system.
Right.
So it makes your immune system like Superman.
Oh, okay.
But so that will fight hopefully the cancers. But what it can do, it can be so good, it can attack your own organs. So what I've got to do is I had to have a blood test every 3 weeks prior to having the immunotherapy
To see
if it was attacking anything.
Okay.
So I had 4 months worth of this, and just before I went on vacation, I popped back in on the Thursday for my blood test, and this is all down in Guildford at St Luke's.
Yes.
And she said, "I'm sorry, Matt, but the immunotherapy hasn't worked, and it spread to your other lung."
So hang on a minute. So when were you told that?
I was told that
because you went on a holiday just before you went on the holiday.
Yeah, we flew on the 10th, so I was told on the Thursday before the 10th of July. So it was around about that was the Thursday. Well, anyway, it was
doesn't matter.
It was a few days back from the 10th.
Days.
I flew on the Wednesday.
So a few days before your holiday.
I was told 6 days before. So basically, when I went and she said,
what did she say?
I was about to say this to you.
Sorry.
What she said to me was, "I'm sorry to say, but it's gone to your other lung. So it's in both parts of your lung now, both your kidneys and your abdomen, and they found some sort of fluid around my heart." So she said, "So tomorrow when you come in for your immunotherapy, it won't be immunotherapy. It's going to be full-on chemo."
Right.
So me and Joey walked out there again. Here we go again. By which time,
how did you feel?
I don't know how I felt, because I was just like, this is just like, because I feel so good and I don't have any pain, and it was just.
You've got no pain.
So
at the moment.
we obviously got over that. And looking
I mean, other than the breathing issues.
Yeah, breathing issues is there a little bit, but that's the only issue I have. I couldn't sort of do the 100 metres now
and
without stopping halfway.
And also, you had the operation on your leg.
Oh yeah, I forgot. Well, I haven't got to that. Then sorry, I forgot about the leg. So yeah,
it's
that's
so much.
So yeah, basically I've got it in both my kidneys, my abdomen, both my lungs. The brain should be okay now, and I've got a titanium pin stuck in my leg here now. You can see all the scars. Because they found cancer in my leg here, which had eaten away in the bone, and they said that if you had walked around any longer, you'd have broken your leg. So they put a titanium pin in there, which is really good. Does that, doesn't it? That's fine. Legs are a bit skinny.
Did you beep when you went through security at the airport?
I didn't actually. I didn't actually. That was quite funny actually. But,
I would think that you would.
So basically, when I found all this out, I had to go back on the next day from full-on chemo, and basically what it was, you're supposed to take steroids up to the build-up, but what it was so rushed. They knew I was going on holiday. They had to give me a really great injection of steroids, and excuse me. Sorry about that.
That's okay.
That's better. So yeah, I went in for the immunotherapy. 8 freaking hours I sat there, and they just sort of plugged me in, and I went in weighing so many kilos, and I came out weighing 2 kilos, and when I went in, every time I had to have a wee, I had to wee in this little bucket and measure it and write down on a piece of paper.
I wonder why you actually come out weighing more.
Because I got all the fluid in me.
Oh,
see all the fluid, all like these bags, they're like little pillowcases, and they fill me all this fluid.
And you're there for 8 hours.
And I was there for 8 hours, and I came out. And obviously a few days later, you'll see on the footage that Jasmine's going to put up of my holiday, and it was the best holiday of my life. It was so lovely. And I went back to Gibraltar, where I lived 20 years ago, and my eldest daughter was born there. Joey was born there, my baby mother.
Baby mother.
As you can see, as you can see at the moment, I'm living in a garden in my caravan.
Well, no, you actually. I mean, this is actually lovely.
And this is where I'm living now. So
you actually live with your ex. My baby mama.
Yeah, baby mummy.
Baby mama.
You can take it backwards and forwards.
Okay, but the thing is, it is back, so I can see it properly.
Yeah, cool.
But you also live as well, which obviously you
the thing is, the reason I'm doing this is because I don't want to be on my own. I still have my flat, which is a council flat, and the government are paying for that. It took me a long time to get over leaving work, because obviously they said, I think you better give up your job really and live your life to the full now, because You don't
Absolutely.
Really know, you don't really know how far you've got. But now that I'm on the chemotherapy, I had my second one on Friday. Felt a bit tired coming out. You'll see a video actually that I did afterwards that Jasmine will put up at a later date. But honestly, I feel so happy, but I get scared sometimes when I'm on my own down here, and I think I really don't want to wake up in the morning and have pain in my kidneys or my quality of life changes. That's my little worry. Because at the moment I feel brilliant. I've never felt so good. So the initial finishing work was really hard, like 'cause giving up work, I felt like I was giving up life because I've worked all my life, you know. So I just felt that it was giving up life. But no, since I've left work, it took me a while to get over that. I ended up taking, I'm on a lot of medication now because I had really bad anxiety, which I never had before. I was like, you know,
Yeah, that's strange.
It was really odd. I was freaking out about the number 10 for some reason. Why would I do that?
Number 10.
Yeah,
Can you
I know.
tell me about that 10?
Well, I just don't know. The number 10. I saw a program on the TV, and I was trying to remember something. It was driving me mad, so I had to go on my phone to find out about it, what it was I watched. But now that I'm on beta blockers, it keeps my heart rate down.
Yes.
I've taken diazepam now as a derivative of happy pills. I take 2 of them a day.
Okay.
I take some. This is what I'm taking. I take these every day. There's my little selection of what I take. These are diazepam. These are what folic acids. These are anti-sickness pills. I take those for 4 days afterwards because of my stomach.
How many pills a day?
Oh, there's quite a few. 1, 2, 3. I can't count. So look. That's what I take. So yeah, there's a lot. These are happy pills. These are my painkillers. That's what's the ladies take when they're pregnant. That's my beta blockers.
Folic acid.
That's folic acid. That's, I'd say, a beta blocker for my heart. This is an anti-sickness pill, and that is the funny name for that one. That one stops me from getting tummy-ache from taking too much medication, basically.
Okay.
So that's what I take every day.
Yeah, but what's in the other bit?
Which one? Oh, they're the same. They're
Oh, the same.
It's for another day.
Oh, okay.
Because up here, it's actually, if you look up here, there you go, look.
Oh, right.
That's how I do it normally.
Oh, okay.
As my daughter's just popped her head in. Hello, Tia. We're making a little video about how Daddy is. That's my
Hello,
beautiful
Tia.
daughter.
Hello.
I can't
Yeah.
really see you much
Come over
because...
here. Give your Dad a cuddle. Come here.
I need help about Roblox.
All right, we'll give you a hand. We'll come give you a hand. And give us a kiss and a cuddle.
I got dust on my face.
She
But
obviously
we'll-
knows. She knows about it. You know,
Yeah.
we kept her in the loop about how Daddy is, and that's why she's enjoying her life. We've got the whole summer ahead of us now. She's just on holidays.
Did you have a nice holiday?
Yeah.
Best
Yeah, you
holiday
did,
ever.
didn't you?
My second favourite.
And
That's
you know
second favourite.
what? Come up, Daddy will come and help you
Yeah, if
as
you
soon
go
as
up.
we finish.
And I'll give
I'll
you a hand.
have a hug
you
and
a
a
hand.
cuddle.
All right. You can go now, son. I've go away. Not too much
Very
cuddling.
sweaty.
Bye now. Had your fun.
Okay. Right.
This is quite a long video. Do you want to stop it and do
No,
another video
not
afterwards?
at all. No, because
Okay,
I just wanna say something
Okay.
to kind of wrap it up and maybe
Brilliant.
do another one
Yeah, exactly.
about your holiday, which is happy.
Oh, yes.
Happy video,
It was
yeah?
brilliant. And
Right,
it was
but
lovely.
what I want to say, in most of your videos, because obviously we were Facebook friends,
Yeah.
and I can see most of your videos, you would always say, "I'm loving life,"
I am.
which, in my opinion, in itself, it's inspirational.
Yeah, it's just. I'd like
It's
to give that across to
somebody
other people too, because
say, "Loving life."
Yeah.
I'm loving life.
it's amazing. Because I'm not dying
How
of cancer.
can
I'm
you
not
feel
dying of
so
cancer.
happy?
I'm living with cancer. I'm
That's
doing the best I can with it. And at the moment,
that's the
it's
best
brilliant.
best mindset.
Exactly. I'm living with it. I'm getting on with it. I've got everything around me that I need now.
So you're not dying with it,
No,
you're living with it.
cancer, you know, and obviously.
And this is the journey of your
Yes,
cancer,
precisely.
which we're gonna obviously record.
Yes.
But
And obviously there'll be some days when we record where obviously I'm going to be feeling a bit ill, but then it'll be those are the good days you can see not this.
well,
happy
no,
mats.
you can see this one now,
No,
quite
you can see-
brown. Look,
You might see the hairless ones.
Look,
so all my
look,
hair falls out and I
with a
turn yellow.
gecko, and
Yeah, my gecko.
let's show your gecko.
You know, they're everywhere. I'm very lizard. I like amphibians.
Yes,
I'm
he's
mad
very
for fish.
lizard mad, especially gecko, as you can see.
Yeah, exactly.
And yeah, that I think we're going to wrap this one up because
Okay,
this is a
darling.
very good video.
Brilliant. And you can if you piece it all together with the rest of my holiday video. No, okay.
Right. So but we're gonna actually do another one now with the happy memories actually that you made on your holiday
Brilliant.
recently.
That's brilliant. I look forward to
So
seeing
yeah, goodbye everyone. So
Tatty bye.
what would you like to say at the
Oh
end?
no, I just hope this inspires you guys. You know, it's like I've got it, and I'm sure it's going to take my life. I don't know when, don't know where, but again, like I
Well,
said
we
before,
all gonna die
nobody's got
one
a
day.
crystal ball. Some people say you
Exactly.
got 7 months to live, and 7 years later they're still kicking around being fucking
Ah.
annoying. Excuse my French. But there you go. You know, I can just annoy the hell out of all of you, and I might just get better. But I don't think so. I've got so much in me, it's ridiculous. But hey, I'm
You
so
never
positive.
know.
You never know.
You
Exactly.
never know. No one has that
Well.
crystal ball.
Keep it strong, guys, ladies and gents. Enjoy life.
And
There you
take
go.
care.
And take care.